A woman successfully gave birth to her baby successfully, and 2 days later something happened. The successful delivery turned to sadness, turned to something else. Now let's talk about it. Please, if you're a mother here, you're pregnant, because I realize so many people are pregnant like following my page. If you're pregnant or you're intending to be pregnant or whatever, please don't take the hospital you're choosing like a joke. Don't, please be so sure of the hospital you're going to choose for your delivery. Be very, very sure. It happened to me in my first pregnancy. I'm still going to talk about it, but now let's talk about this woman that gave up after 2 days of delivery. So a man published by Punch TV said the wife on the 1st of December 2025 was already in labor. Okay, before then, they went to check the baby's weight. According to the doctor, the baby weighed 3.8. The man was like, okay, is this weight not too much for this baby? But according to the gynae said no, the weight is not too much, that she can deliver. Of course, 3.8 kg is not too much, but I don't know at what week they got that 3.8 kg, right? Because I've seen people that say they deliver their child 4.5, 4 kg. So on that fateful day, on the 1st of December, the wife went to the hospital. They checked her and they said, oh, she was already 2 cm dilated, and they now gave her augmentin and some other things to induce the labor or make the labor faster. So when it was time for her to push, she tried pushing and the baby wasn't coming forward. The head of the baby was too big, so they gave her that their normal cut, and she was, after 4 push, the baby came out. And when the baby came out, according to her, while the other consultant was carrying the baby, he called another of his colleagues to go check the woman. Is it to go cut off the cord, umbilical cord, right? So according to him too, that the other one was shaking as if he's not used to this kind of thing, right? But at the end of the day, that one cut it off. But in his explanation, I'm just so worried about so many things. Number one thing, I was worried, he didn't let us know if the placenta, if he saw the placenta, if the hospital actually gave him the placenta of the woman, if they bettered the placenta, right? And I hope they did not forget the placenta in her stomach, because according to him, she was pushed to the wall. After they stitched her, the woman was complaining that the stitch is painful. Of course, it's always painful, and it's just painful. So later, when she got to the ward, she was complaining that she wasn't getting herself. So the husband called the doctors to come check on her. They came to check on her. The person that made the stitch was like, oh, it's because you have a pie. I have pie. I have that pie, that pregnancy induced pie. So I don't think that could be a reason for sorry. So while the woman complained about the pain and all of that, the husband called the doctor, the consultant. That one said it's pie, it's nothing to worry about. And she was bleeding. They said they were just soaking pad. I don't know how much is the bleeding, but she was bleeding very well. So the husband have to escalate to the higher doctor. The doctor came and checked and said, oh, and examined the cord. And meanwhile, he said why they were in the labor room after the wife delivered. Of course, they do it. They leave the stitches for junior people. I was stitched by a junior, I think a student doctor self in my second pregnancy, right? So the doctor went to attend to something. He said the woman came for antenatal, which is not even an urgent stuff according to the man, right? So when the doctor went, there is no problem. So they came to monitor the stitch, the wife's stitch. Okay, this particular doctor that left the wife came to monitor the stitch and said, oh, the stitch is too tight. I think we should take her back to the labor room so we can loosen it. They took her back to the labor room. Now I have so many questions, because something happened and there's something raining now. They say they used to leave pad in some women's womb. After cleaning it up, they will leave it there and they will ask you to take it off later. My hospital, they don't do it. Now if you check very well from my video when I was delivering, I was so selective about the hospital I was going to use. Yes, I did it on purpose. I never wanted to use anyhow hospital. I made sure the hospital I was using was a high-class hospital. They came to check on me more than 10. At the point I was exhausted. They checked my vitals more than how many times in a day. They would ask me any complaint, do you have any problem, any issue. They kept asking me this thing more than, like, at some point I was like, why are they even asking me? As they are checking me, they are checking baby. As they are checking me, they are checking baby. Now I understand why. Because from this man's explanation, it's very obvious that everything that happened was due to negligence. It was due to those people, they did not really care, and they put the name of the hospital. They did not really care, because according to him, when that stuff was happening, they took the wife to the 3rd floor and he looked around, there was no oxygen. Firstly, now you notice something about this stuff. where you are, there's no oxygen. They came to check. When after stitching that thing, did you ask if they bettered the placenta? According to the man, he said at some point they said it's internal bleeding. So internal bleeding, what did you do about it? You people should go and watch Aproco's doctor's video and do what he said. He said before you go to any hospital, make sure there's something he said they used to stop bleeding. And I'm wondering, don't they have it? They said they were busy. As the woman was bleeding, they were transplanting blood. They were giving her more blood. They would give her 1 pint. She would bleed it off and all of that. What sort of nonsense is that? I was so pissed at everything. This could be something that maybe have been avoidable when it become an urgency. He said they drove from Ekate, where I delivered was in Lekki Phase 1. And it's just barely 5 minutes to 10 minutes from Ekate. So, and I'm wondering, did they not see that hospital? It's a very big hospital. Everybody knows it. Did they not see it so they can just rush the woman there? That's why hospitals are supposed to have a relation. They said they are taking her to the island. And the man said he noticed when they were turning around, they were not even turning around very well. They were acting like they don't have any destination. They will go to this place and he have to cross them, give them a double crossing, and was like, where are you people going? What are you people delaying? They said they are going to Marina General Hospital. He had to drove to that place and all of that. When they came, the hospital gave them, said it was death on arrival. And meanwhile, while in his own hospital, he said after the stitching, the woman was so unconscious. He said because he was so confused. This is their first child and this man is barely 1 year in his marriage. He was asking, is this how other women give birth? He said, this my wife did not give birth through CS. So why can't she be able to breastfeed that baby? That she have seen other women, when they give birth, at least they will carry their baby and breastfeed their baby. And understand the fact that if you give birth successfully, just give glory to God. That the wife became so unconscious, or just sleeping, feeling tired, that the last thing the wife said to her was, baby, let's pray. And that was it. She didn't talk again. She started having convulsion. At the point, she even had to fall from the hospital bed. And I keep asking, what kind of hospital is this? See, as a pregnant woman, prioritize the hospital you're using. If you don't have money, go to general hospital. Not maternity, not this maternity that is. Go to general hospital where they have equipment, have oxygen, have all those things. In my first pregnancy, I went to a private hospital. I zoomed all these duplex private hospital, and they messed up with me. I almost lost my life. That was where I had my cervical tear. They couldn't even identify it. I almost lost my life. I almost lost my child's life. That my child is the way he is at 5 years. It's because of the hospital. It's because of their negligence. So I'm saying this to help you, to educate those women. If you know you're pregnant, please visit a good hospital. If you don't have money for a standard good private hospital, go to general hospitals. After my first child, I never went to that hospital again. That was when I had to start using this hospital. It's very expensive to deliver. I think it's about, is it 1 million? Before it used to be 500,000. That normal delivery. I think their CS is about 3 million or so. I'm not too sure. Maybe you can go and make your inquiries. But I make sure I use the hospital. So if you can't afford it, you go to general hospital. Because tell me, all this negligence, all this, a woman that gave birth is bleeding. You guys were so reluctant. You didn't even give her injection to stop the bleeding and all of that. And later on, the hospital brought out this nonsense report that was vexing me the more. They are trying to implicate the family or what? Just read on. Saying the woman drank pepper soup after delivery. That the woman drank pepper soup after delivery, that he doesn't know what they put inside his pepper soup, that it could be the pepper soup, because the kind of thing, the woman was bleeding from her hand and he has never seen it before in his 30 years of practicing, and he went to consult other of his friends. They've not seen it before. I understand, but what did you do? According to the man, it looked like you guys were non-serious, like you guys did not take it serious. Is it because you guys don't know what else to do? Why not at that moment you realize that there is nothing again in your hands to do? You move fast. He said when they came down from he was even the one telling them to push. When they came down, the ambulance was still covered. They've not even uncovered the ambulance. It was there. He was telling they should start and just start taking the woman back. That is the pepper soup they are suspecting. It's not the same pepper soup woman go bond. You go, if you don't have internal bleeding or if you don't have any cause to bleed, the main purpose is not for some things, some bad clothes to wash out from your body. So what is it about the pepper soup you want to blame? What could they have put into the pepper soup? Or are you trying to say they poisoned the pepper soup, the woman that just delivered? I'm so sad seeing this because it's not like it's serious complication. This is normal delivery. This is something that could be avoidable. It's obvious that it was bleeding because they said what killed the woman was whatever shock, and they said that thing happens because of lack of oxygen. They said it happens because of lack of oxygen due to bleeding or whatever, or due to lack of blood or whatever. I'm so angry. So if you're pregnant mom and you're in this page, please take it seriously. If you go to the hospital, make sure it's a standard hospital. Make sure you ask necessary questions. Make sure you tell your husband if anything goes wrong, they should keep pushing, because that was how my husband was pushing in my first pregnancy, that they were able to transfer my child. My child 3 days in their hospital was my child 3 days in their hospital was passing out. They didn't do anything to it. They don't even have a pediatrician. 3 days was passing out. So when my husband pushed and forced them, they now recommended us to 2 hospitals. One, this one we are now going to now, a very big hospital at Lekki, and General Hospital. That was when they now recommended us to this hospital. And we thank God that my husband pushed and intervened. If not, we would have lost that child. They would say, oh, after the delivery, 4 days later, the child did not make it, 5 days later, which is negligence from some doctors and hospitals. They are doing more. And it's not everything they say you are. Sometimes stand on your ground. Have your own decision. Tell them this is what you want, especially when you're sure of what you want. Anyways, thank you guys. This is what I want to do. So please, if you're a pregnant mom and you're in this, prioritize the hospital and do not allow these people play child on your body. Every mother, a pregnant woman, or everybody, the pregnant women or the intending to be pregnant women, or anybody that followed me because of my page, you need to listen to this. So there's a video Punch TV published of a man who was crying on the 1st of December. The wife was in labor. But before we go into it, what really causes death during delivery and all of that, apart from the fact that people are always scared? You're scared because it's a 50-50